Okay, welcome. Today we're going to be talking about a case involving this person right here, a guy named Dax Cowart. Uh, this is a case which highlights the importance of thinking about autonomy in medical ethics. Uh, One thing that we can note right at the outset is that this is a case based on events that happened in the early 1970s. And in that time period, about 50 years ago now, it was more common for medical practitioners to take this sort of doctor knows everything sort of approach. When we talk about a doctor knows everything kind of approach, this is sometimes called a paternalistic approach, where doctor knows best, right? They say, look, we are the professionals in the room, we know what's good for you, so we will make your decisions for you. This case of Dax Cowart, this is a photo of Dax as a young man before the accident. We find in this case that he had his autonomy overridden for the sake of his well-being. But what we also learn is that eventually Dax insists that he should not have had his life saved by medical practitioners. He shouldn't have been put through the pain they put him through because he was, as he thought of it, competently refusing that treatment. So here's the plan for this video. By the end of it, you should understand what happened to Dax, what reasons were given for treating Dax, but also the reasons why Dax wanted to refuse treatment. And we'll end by thinking about how things have changed since the 1970s, and we'll be thinking about how we can think about this case as involving an interplay between different principles in medical ethics. What were the principles of the doctors who treated him over his objections? What's the principle that justifies Dax's approach? And we can even think about the question of whether things have changed for the better, that we often do, from a contemporary perspective, put more weight on autonomy than duties of beneficence. So, to learn about this case, I encourage you to go watch documentary footage. There is an old 2020 news report from 1999 about Dax that will give you most of these details that I'm just going to run through quickly. And I think it's really important to hear things in Dax's own words and even see a little bit of footage from his treatment. But let's just do a quick recap of what happened to Dax. So Dax was in a horrible accident when he was in his 20s. He was in an accident where about 65% of his skin was burned. What happened was he was trying to start a car. He didn't know that there was a propane leak in the area, and he ended up having to run through a wall of fire. Immediately after this accident, Dax finds a farmer on a nearby property, and he asks that farmer for a gun. He tells the farmer, "Can't you see that I'm a dead man?" This farmer refused Dax's request for the means to kill himself, and Dax was summarily rushed off to an emergency room in Dallas. Now, in the wake of this accident, Dax's father was also there. His father died before he got to the hospital. They were able to stabilize Dax. Now, once they stabilized Dax, they needed to treat these extremely terrible wounds. Part of the process for treating these wounds was to bathe him in a solution of disinfecting liquids. So this would often be a hydrogen peroxide bath. Also, you could think of that as a bleach bath that would get the dead skin off his body, redress the wounds so that he wouldn't die of an infection. Now, early on in this case, Dax was telling the doctors and telling the nurses to not treat him. And the doctor working in that ward, Dr. Baxter, basically assumed that Dax was not of sound mind when he was initially refusing that treatment. Yeah, as I mentioned, this treatment would involve redressing and cleaning his skin with a bleach solution. Extremely painful. It's horrifying, but if you watch the documentary footage, you'll hear Dax crying out in pain, telling the nurses to go easy on him as they cleaned the wounds. He was in evident, excruciating pain. He had also lost fingers, was blinded, and had his hearing damaged. So he was in a state of complete and utter uncentering with his body. He was in a very bad state, and the treatments were extremely painful for him. He would have likely died without these treatments because of infection. And in this situation, Dax's mother was given rights of proxy consent, and Dax's mother was insisting that Dax continue with the treatment in spite of his protestations. In the documentary footage, you'll also see that Dax's mother wanted him to come around to the right religious views, as she seemed to put it, that he needed to recognize his responsibilities to God, as she was putting it. So she kept treating her son. It's very easy to take an unkind perspective on Dax's mother. We might also understand what an excruciating situation she was in. Her husband had just died, and now her son is terribly disfigured and also wanting to die. Even if we think she maybe made a wrong choice by going against his wishes, we might also sympathize with her in this situation. There's a worry here. A worry is something like this. It's a worry of presumed incompetence. Basically, it seems like something that will happen in medicine is a physician like Baxter will presume that patients are incompetent if the patient disagrees with them. We can think of this as putting the patient in a really weird double bind. The doctor says, well, we should dress these wounds. Of course, if Dax said, all right, go ahead, Dr. Baxter would think of that as competent acceptance of that treatment. That is competent consent. But if they refuse, then, well, simply in virtue of refusing, they're treated as incompetent. So we might think that we have a case here where Dax is refusing his treatment, arguably for good reasons, but the people around him are treating him as an incompetent patient. Now, eventually, they brought another doctor in. Dr. White was a psychiatrist. Baxter brought him in order to have him deemed incompetent, although the more conversations that Dr. White had with Dax, he realized that he was a stubborn person, but a person who understood what he was asking for, who realized that by stopping these treatments for his wounds and repeated surgeries, he realized that he was putting his life on the line. Now, the sort of sad or maybe strange part of this case is Dax was eventually deemed competent to refuse treatment, but by the time he was deemed competent to refuse treatment, he then couldn't find a lawyer to release him from the treatments, from the hospital, and to remove his mother's proxy rights. And by this time, Dax had stabilized enough that he realized that he was going to live anyways. Now, here's the next strange part of the story. We're skipping ahead. So in the middle here, we should note that Dax has said himself that it took him 7 years of trying to get his life back together. He moved back in with his mother, bristled against the lack of autonomy that he had in that situation, and he did attempt suicide on more than one occasion. But Dax eventually went on to live a successful life. He eventually got a law degree from Texas Tech, and eventually took training as a trial lawyer and became a successful trial lawyer. Also spent time advocating for patients' rights and telling his story to law schools and medical schools around the country. So Dax made something of his life. If we were to take a cost-benefit analysis, think about all the pains that he had to go through in those treatments in 1973 and 4, and we compare that to everything else that Dax went through in his life, and he was a person who did lots of things, right? He won court cases. He enjoyed music. He took up karate. He, in fact, I believe, married 3 times, divorcing twice in the midst of it. But he was able to get many good years of life. So he probably had his life back on track by 1980. If it took him 7 years to get his life back in order, as he mentioned in one speech. He would eventually live until the age of 71. He died of cancer in 2019. But Dax ended up having a successful and happy life, a life worth living. Now, here's where a philosophical question emerges. We might ask, well, if Dax ended up having a life worth living, a happy life, a successful life, we might even think he found his ways to flourish, in spite of his burns, in spite of the disabilities that he was never able to recover from. He was still able to live a happy life. We might wonder, well, maybe the doctors did the right thing, caused maybe more happiness than suffering overall by treating Dax against his will. The other perspective that we might take, and this seems to be Dax's perspective, is that even though Dax went on to have a prosperous, valuable life after his treatment, and this is what Dax says, he thinks that the doctors still messed up, that they did something wrong when they refused to listen to his request to stop treatment. And even though he liked his life, he still thinks that he should have been allowed to die. Right? So, from this perspective, we might say there's more from Dax's perspective and many people's perspectives who deal or who agree with Dax. There's more to doing right in medicine than following principles of beneficence and non-maleficence, right? That is to say, benefit the patient as much as you can. It is your duty to help, and non-maleficence is going to tell us don't bring harm to the patient, or bring only as much harm to the patient as you need to. Well, they did have to bring a certain amount of harm to Dax by dressing his wounds, stabilizing him, and putting him through multiple surgeries. But we might think that that's ultimately overweighed by beneficence, all the help that they gave him by giving him his life back eventually. We might think that we have to be thinking about patient autonomy as well, right? That we're doing something wrong to Dax if we force him to receive this treatment when he is unwilling to accept it. Here's something that Dax says in a reading where he's speaking with another bioethicist, Robert Burt. But here's what Dax says. He says, "When I was in the hospital, there were many reasons I wanted to refuse treatment, but one was overriding the pain. The pain was so excruciating, it was far beyond any pain that I ever knew was possible. I simply could not endure it." I think it's important to note that there was pain. It was very hard to endure. But we should also note that autonomy and the refusal to undergo pain is of great significance here. Because we might realize that it's okay for a doctor to put you through a certain amount of pain if you've signed up for it, right? So if you willingly consent to getting orthodontic surgery, it's going to hurt, right? You're going to feel bad, definitely for a few days, right? But we might say the doctor isn't wronging you because you consented to that pain, right? You have, in a certain sense, waived your right to not suffer at someone else's hand. Well, Dax never waived his right to not suffer at someone else's hand. And as a competent patient, we find that pretty problematic, right? So we think that the consent that's necessary for treating an adult patient was not present in Dax's case. Now we might start to think about, well, how does this case of treatment without consent compare to other cases? Speaking with people about this case over the years, I've gotten the sense that most people think that what the hospital and what Dr. Baxter did to Dax was wrong. But we might start to wonder, well, maybe it was wrong to refuse Dax treatment, but I also have met a lot of people who think that it's a good thing that we disallowed depressed people from accessing euthanasia. Right? Now, we might think that, look, if we take autonomy super seriously, we might think, look, if a depressed person is able to understand what they're asking for when they ask to be euthanized, well, if we really take autonomy seriously, maybe we would begin to soften up on this claim too, right? But other people might say, well, maybe there's a difference. Maybe Dax has more competency than the people who are asking to be euthanized on the basis of their depression. Or we might realize that the pain involved with Dax's redressing of his wounds is somehow different than the pain we would relieve a depressed person of. We might notice, for one thing, that the pain that Dax was going through was caused by medical teams, whereas the depression and the suffering that comes along with it, that depressed people might ask for euthanasia on the basis of, isn't caused by medical teams. There's a case of a teenager who was required to receive life-saving chemotherapy that they did not want. Well, we might try to figure out whether there's a moral difference. Now, one way we might go, again, is to say, look, if we really respect autonomy, we should let the teenager have the final say and let her refuse the chemotherapy, even if that causes her to die. But we might try to make distinctions as well. So if you think that it was not okay to treat Dax above his will, but it is okay to treat the teenager with cancer against their will, then you've got to give an explanation from a philosophical point of view, right? So we might say that the explanation that we need to give is quite possibly one where we say, well, there might be a lack of competency on the teenager's part. We might also think about involuntarily committing a person to a psychiatric ward when they are a risk to themselves. Now, on the one hand, we might think that this is quite similar to Dax's case, right? Where we have a patient requesting something and them being treated over and above their will. Again, we might say, well, maybe the reason why this is okay is on the basis of the claim that when we prevent, say, a person from committing suicide when they are a risk to themselves, well, this might be a case where that person is not acting in a fully rational, autonomous way. So I invite you to reflect on these cases, right? Because it might help us to understand not only what was wrong with how Dax was treated, but to also understand the borders. Where do we draw the lines, ethically speaking, right? And if there are some cases where it's okay to treat a person without their consent, what are those situations? For one thing, we might notice with Dax, it was probably right to stabilize him and bring him to the hospital, maybe even perform the first surgery that was necessary to save his life before they were able to sit him down and have a conversation about it. Right? But then we can also say, and we can also ask, that at some point, Dax must have gotten into the situation where there was a chance to pause, explain the situation, and where Dax was able to have his say. We might start asking questions like, what are we supposed to be looking for when we have a competent patient who's making a genuine refusal that needs to be taken seriously? So, there's so many things we could talk about with this case, but we'll think about it in these terms, right? We can think about three principles that are often operating in medical ethics, right? Respect for patient autonomy. Of course, patient autonomy in this case seems to say that Dax should have been allowed to end the treatment and not live. But we also realize that doctors have duties of beneficence, that is, promotion of what is best for the patients, and non-maleficence, not bringing harm to patients. Now, oftentimes, and this was a trend in bioethics, in the 1970s and before, beneficence would often take priority over autonomy and non-maleficence. So there were fewer procedures for properly getting a doctor's consent on a treatment, and oftentimes medical decision-making was simply left to the head of a household, right? So a husband might make decisions about their wife's medical care or their parents' medical care without full consultation for that patient themselves. Now, the thought there is the head of the household and the doctor collectively know what's best. But of course, that's taking priority over autonomy, right? And we might also notice that non-maleficence. You will put a patient through a certain amount of pain by giving them surgery, but we think that, look, oftentimes that can be outweighed by beneficence, making the patient better off in the long run. But we'll notice that this doctor knows best mentality was much more prevalent prior to the 1970s. Now, Dax was one of the first patients to be deemed competent to refuse their life-saving medical treatment nowadays, and there were other cases in the 70s where patients started to win legal challenges, basically saying that it should be up to the patient, ultimately, to decide what to do. And considerations of autonomy tend to override considerations of beneficence and non-maleficence. So nowadays, for instance, it would be quite normal for a patient to decide that it is best for them not to keep going with chemotherapy, even if the doctor thinks that that's a foolish decision. Ultimately, the patient's decision will lead the way. We might also notice that it's highly frowned upon nowadays to not inform a patient of their condition, whereas in the past, a spouse or a parent might have had something like a cancer diagnosis hidden from them. So a trend in the last 50 years of bioethics has been a trend towards emphasizing the autonomy of the patient. And if something were to happen like Dax's case nowadays, Dax might have been allowed to refuse the painful redressing of his wounds, and might have been allowed in fact, to die. Now, part of how we get out of this dilemma as well is that nowadays they have better methods of both managing pain and they have better methods of treating infection. But we can still ask questions about whether we might even swing the pendulum in the opposite direction. So Atul Gawande, an essay in this book, Complications, Gawande does suggest that there are ways in which maybe autonomy can be taken too far, right? To think of autonomy as the supreme and overriding value in medical ethics could actually cause doctors to make mistakes or to not press their patients enough when the patient is clearly making a foolish decision. And we might ask whether there's a way of not just giving autonomy priority or thinking it's the first and last thing to be thinking about in medical ethics, but how we balance it and try to get it working together with principles of, say, beneficence and non-maleficence. But certainly, when we look at this essay by Gawande, Gawande is responding to a shift away from this paternalistic, doctors knows best approach to an overly, perhaps, individualistic and autonomy-driven approach to medical ethics. That said, when we ask questions about what the justification is for giving autonomy such a massive role, well, we might point out that ultimately doctors are working for their patients and not anybody else. And we might also realize that patients are able to give the best evidence of what their values are, what their goals are, and whether a medical procedure is necessary for them. So we might still be deeply impressed with certain reasons for respecting perhaps the supreme importance of autonomy in medical ethics. And we might also think that Dax's case is a great way of underscoring that level of gravity and importance that we place on respecting the autonomy of the patient. So I'm going to stop there. Thanks for listening in. And again, I'd recommend not just listening to this clip, but going out and finding some footage. Hear Dax tell his story, see some footage from his treatment to really understand what he was going through. So, thanks for listening in, and take care.